COVID antibody, 5 things you can securely do in the wake of getting the COVID-19 immunization. 1. Received your COVID immunization shot. This is what you need to know. COVID immunizations are downright a sacred goal right now for the world, which has been hooked by the viral sickness for longer than a year at this point. As we probably are aware, there are sure things and exercises that actually stay off-limit after individuals get the antibody punches, which may sound a tad bit odd and disillusioning, considering we as a whole have been carrying on a time of limitations and security measures. 2. Do's and don'ts subsequent to getting your COVID immunization shot. Nonetheless, everything isn't so terrible. Similarly, as the antibody would function as a preventive method to moderate the flooding pandemic, there, notwithstanding, are sure things that immunized individuals might be allowed to do. As per the recently delivered rules by the Centers for Disease Control and Prevention, CDC, individuals who have gotten the COVID poke might have the option to do a few things which they beforehand couldn't due to the overall pandemic. We rattle off a couple of these pre-COVID exercises you might have the option to cheerfully continue. 3. Be maskless around other inoculated individuals. While you can't just trench your covers off in the wake of getting the antibody, there's one thing inoculated individuals can do, which is to take their veils off when they are available with other immunization recipients, which means you no longer to stay away from individuals and securely accumulate inside if everybody has been inoculated, since there can be no dangers there. In any case, recollect that veils possibly fall off when you are around other immunized individuals, and you can participate in exercises like these solely after you get your subsequent shot. An individual is simply viewed as completely vaccinated 14 days after they have gotten their second COVID immunization shot, and not whenever previously. Regardless of whether you do create guarded antibodies with the principal shot, you will in any case not be considered completely inoculated. 4. Care for somebody with COVID. The one thing you can do subsequent to getting total portions of antibodies is begin providing care for the ones who may be experiencing COVID-19. This is one reason why shots have been focused on for those on the forefronts: medical services laborers, specialists and fundamental staff. While fundamental safeguards, for example, veil wearing and hand cleanliness, will in any case should be followed, with COVID vaccinated records, you'll have distressing odds of getting contaminated from direct contact. This will likewise give a positive feeling to the ones living in close contact with tainted patients, like relatives. 5. No requirement for isolate on the off chance that you get uncovered. CDC rules likewise recommend that people who have been vaccinated against the viral disease, for example got 2 shots of the immunization, will at this point don't have to rehearse isolate measures, including getting tried. Confining yourself from the group as an inoculated individual would be vaccinated against the infection. Notwithstanding, a few specialists caution that the ones with comorbidities, who live in a social environment, seniors who dwell in a consideration office, living in a joint family or living in an inn, should in any case rehearse essential isolate gauges and get tried, since they might be powerless to low insusceptibility. 6. Visit unvaccinated gatherings, with precautionary measures. There's an enormous segment of individuals who actually aren't immunized and may not acknowledge the immunization, leaving them unprotected. Notwithstanding, this doesn't mean individuals will blend once more. The ones who are inoculated can visit or invest energy with unvaccinated individuals, including children and grown-ups, visit companions and family members subsequent to following fundamental safety measures, like utilizing a veil around high-hazard individuals, incessant hand-washing and sterilization. Being around unprotected individuals will not damage you in any capacity, or leave them in dread of getting COVID, as long as you have gotten both of your portions of the COVID-19 immunization. 7. No need to get tried in the event that you don't have side effects. As per the most recent measures, inoculated individuals won't need testing regardless of whether they are presented to the infection. At the present time, fast testing and screenings are one of the predominant measures to distinguish the contaminated ones from the non-tainted ones. Be that as it may, whenever individuals are inoculated, they may not be liable to testing, except if they have side effects. This is basically in light of the fact that the pace of suggestive contamination is low, and the transmission rate is additionally lower, which implies that inoculated individuals, regardless of whether they do contract COVID-19 again, may not go about as indicative spreaders and represent a danger. 8. When is an individual completely inoculated? What time would it be the most secure to do as such? The rundown of exercises you can do appear to be content information, particularly on the off chance that you are somebody inclined to high weakness. That being said, To get the greatest security from your COVID antibody, it's appropriate right since you get the 2 shots of the immunization at the right time. Since insusceptibility with the COVID shot right currently is as yet problematic, it's pivotal you practice most extreme safeguard till an offered time to make the antibody work for you. This is what specialists need you to think about something similar. Connection to story. Guarantee that you don't pass up a major opportunity, or postponement getting the subsequent shot, which is critical to protect you from the infection totally. Ensuring that you get the 2 portions of a similar organization is additionally urgent. The ones who may have had COVID before may just require a solitary shot, which can be affirmed with the specialist. Notwithstanding, do ensure that you do rehearse certain safeguards until 14 days after you get your shot, the time specialists feel it takes for antibodies to completely create. In the event that you do enjoy unsafe exercises, or trench pandemic measures, for example, cover wearing, you place yourself at the high danger of as yet getting COVID. Thanks for watching. Subscribe to the Best for Health channel. God bless us.